107, 104, the real sound of the triangle. My name is Karen Clark, and thank you for joining us for another episode of Triangle Empowered. And what we try to do is keep the community up to date on the important things happening around us so that you are aware. And today we're talking about something that I think a lot of people have questions about. We are talking about vaccines for COVID-19. I've got Rod Jenkins, the Durham County Health Director, with us. Durham, greatest city in the world. Thank you for joining us, Rod.
No doubt. Thank you for having me, and shout out to the Bull City.
Always, always and forever. So listen, when they told me we were doing this, I was kind of excited. I was like, this is very timely. I got my first shot yesterday.
It is.
And yeah, everybody, it's fine. I only have one head, two arms. Everything is okay.
Surprisingly, people are finding that, life goes on. Nothing changed.
It does. It was just like getting the flu vaccine last fall. So it was fine. So let's get to the important things that people need to know. Why is it important that everyone gets this vaccine?
First and foremost, I just want to shout out Durham and their resilience and, really adhering to mask mandates and just really doing all that they can do to keep themselves and their family members straight and their loved ones straight. It's been a trying time, but to answer your question, taking this vaccine is certainly the only way that we're going to turn the corner in this pandemic. Mm-hmm. For the longest time, we've been really looking for that thing or that opportunity for us to get back to normal. And vaccines represent the only way for us to get back to normal. So this is especially true right now, Karen, as we're starting to see numbers rising in other parts of the country and across the world, particularly in Europe. So it's suffice to say the virus is still out there. There's new and more infectious variants that are spreading. So getting people vaccinated as quickly and equitably, as we tend to say, fast and fair as possible is just helpful in continuing to slow the spread. We have to vaccinate safely and efficiently, and we also have to do all the other things that have garnered us success this far, Karen. We have to keep up with the 3 W's. Wearing our mask properly, not sagging masks, not masks under your nose, under your chin, wearing it over your nose, over your mouth, and getting a nice little fit. But wash those hands, and then really waiting 6 feet apart. And then, of course, encouraging others, just like you just said, I got my first shot, and, you're an encouraging person, but just encouraging others to get the vaccine, those who may be hesitant, meeting them where they are, and just letting them know that these vaccines are effective and they're safe.
So I think you hit on some key points. There are numbers that are rising. There's a lot happening in Europe right now. And I feel like in this country, because there's been such a push to get kids back in school and the malls are open and you can go to restaurants and everything, and you see stuff about vaccines, I feel like people are like, we're good. But I was just reading the story the other day about how France just went into their 3rd lockdown. And I was like, ain't nobody trying to do that over here again. We are not trying to go that way. So I think that you hit on some key points. Like, there is still a pandemic. Numbers are rising in different places. And we still have to, practice the 3 W's and wear our masks and do all that, because it's not over. And I am like, I looked back on my Instagram story and I posted something like probably back in April or May of last year. I was like, can y'all stay in the house? Because I got stuff to do in June. I feel that again this year. Like, I'm looking at these numbers. I'm like, no, for real. Can y'all get it together? Because I really do have stuff to do in June this year. I want to do it.
Yes. You're so right. I mean, the weather's getting warm and start to see short shorts and tank tops and everything. And I think people are starting to congregate at different bars and just kind of be out and really feel as if things are like back to the summer of 2019. And unfortunately, Karen, nothing could be further from the truth. We're still in this pandemic. It's not over. So you're absolutely right. They really, need to think before they act. And, there's nothing wrong with being out, catching some sun, going to restaurants and bars, they are open and there's still some rules around it, but just do it safely. Wear your mask. Just make sure that you are keeping yourselves and others safe. But yeah, we more than anybody, I want to get back to those family reunions, being able to do the bus stop and the Cupid shuffle and all that other stuff with my loved ones, but not just yet.
So let's talk about the concerns that people have. It's amazing how everybody on social media is like an expert on vaccines. They're all epidemiologists. Like they all know. They're like, no, it's too soon. It didn't take long enough. Explain to us why that's not something people need to be concerned about.
I will say this, for the most part, the vaccine, if we're talking about the safety of the vaccine, Karen, I will say, the vaccine is truly, truly safe. Some people do feel as if it may have been developed too quickly. And, as a side, I'll just say this. Last weekend, of course, was the Easter weekend, and I was able to really spend some time with some of my relatives who are fully vaccinated because they are over 65.
Mm-hmm.
And, they know that I'm a health director, so they give me the hard questions.
Mm-hmm.
And they said to me, like, well, all last year we went to church and we did our Zoom meetings and Zoom service and everything. And we had our pastors praying that this pandemic would be over.
Mm-hmm.
And now that we got the vaccine, people don't want to take the vaccine. So, I mean, they were just bewildered. Like, we don't understand. We took it because we paid attention to you and everything you said. And, it is just really attributed to a number of things. So let me get a little technical. The technology used by Pfizer and Moderna, which is a messenger RNA, is not brand new. It's been around for decades.
Mm-hmm.
There were no shortcuts in the development of these vaccines. You know how stringent the FDA and the CDC are. Their guidelines are very rigorous and they must be passed. Everything must be passed before they're available to the general public.
Mm-hmm.
So again, for the most part, most people think that, it was done so fast, but let's just understand. A global pandemic such as this called for a global all hands on deck, period. So you had everyone in the entire planet really coming together, brilliant minds, research, labs, all of them came together and they just really developed this vaccine in short order. And to be honest with you, Karen, in the listening audience, it is nothing short of a miracle. For the most part, to get a vaccine that is 94 to 95% effective in the Pfizer and Moderna. The Johnson & Johnson vaccine is equally effective, upwards of 70 to 80% effective.
Mm-hmm.
In 11 months. You mentioned like your flu shot last year.
Mm-hmm.
That flu shot that you took, Karen, is probably 50% effective.
Right.
So
right.
straight out the gate, 95%. That is what you call a home run.
Right.
So there was reason for us to be encouraged. So I would just say to the listening audience, continue to do your research, do your due diligence. Go to credible sources of information. Don't necessarily go to social media because, contrary to what you might believe, everything on Facebook is not.
Say it louder for the people in the back.
Everything you hear on Facebook or see on Facebook is not the gospel. It is not accurate. So I would just ask that, you go to the CDC, go to the North Carolina Department of Health and Human Services website, dhhs.gov, ncdhhs.gov, or, holla at your boy, decopublichealth.org, /COVID-19 vaccines with an S. We're here for you. We got the information you need.
I was having a conversation with Dr. Nicole Swiner a few weeks ago, and we were kind of just talking about the vaccine and everything. And I tried to equate it to the movie Armageddon, when the asteroid was coming towards Earth. And it's like, what do? We're all in trouble. And they were like, we got the best and brightest minds together to come up with this plan to fly a spaceship, land it on the asteroid, and blow it up. It's kind of like that. It's like this was our asteroid, and everybody had to come together to figure out how are we going to save the Earth.
I love that analogy, and it's most appropriate. I mean, but before, I appreciate that permission. I mean, I would just say, that's accurate. I mean, the the dire circumstances necessitated quick, decisive, intelligent action. And that's exactly what happened.
So let's talk about side effects. What do people need to be concerned about? So if I get this thing, am I going to fall out? Am I going to develop X-ray vision? How does it work? What should people expect?
I would say since day one, we have been very forthright and very upfront. We know that, you can't sugarcoat anything.
Mhm.
You have to be very, very forthright in telling people what they can expect. Because again, we are committed to being open, honest, and transparent.
Mhm.
So again, with over about 26,000 people that have been vaccinated at my agency, Durham County Department of Public Health, I've heard from many residents. Some people had experienced no symptoms at all. Some people have experienced some. On the other hand, Karen, I am a witness. I took the vaccine. I've been fully vaccinated, and I've been subjected to some side effects.
Okay.
Some of those include pain at the injection site. You may get a little headache, a little bit of fatigue, like, all of a sudden feeling really tired. You may get some chills. In extreme cases, you may get a little nausea. But for the most part, those are the most popular side effects. For the most part, we have been really encouraging people to hydrate. You've heard a lot in the news about the Johnson & Johnson product. Oftentimes, folks who take the Johnson & Johnson product, they really need to make sure that they put something on their stomach. Make sure you eat something. And most importantly, make sure that you're well hydrated. Drink several glasses of water to make sure that, your body is like ready for this vaccine. What I also like to tell folks is that, if you were to get a vaccine, you definitely want to make sure that, it's working. So if you get these side effects, that is your body reacting to somebody or something coming in contact with your system. Your system is automatically going to react. But I'd be remiss, Karen, if I did not speak about the greatest side effects of the vaccine. And that's joy, that's relief,
Amen.
that's assurance.
Mhm.
I have taken up residence in our mass vaccination clinic here on 414 East Main Street. And I have seen the relief and the sparkle in people's eyes after they've gotten vaccinated. We have that 15 to 30-minute observation period. And it's real, Karen. It's real. Most people are relieved. Most people, they come in nervous about needles, and they're not sure what the process is. And they come into the agency to find that, people are kind and caring, and we're attentive to all your needs. We're going to ask you if you want a bottle of water. We're going to ask, are you okay? And then after a while, you just see it. They're just like, okay, yeah, I did it. So yeah, those are some of the, side effects that, people should really know about.
So we've talked about it. We talked about, the safety of it, the side effects. Now let's bottom line, everybody. Where can we get the shot?
You can get the shot here in Durham. I'd be remiss if I did not speak up about our great partners at Duke. We do have a new site stood up. It was at the old Southern High School. Southern High School was the old site. It's now changed to North Hoover Road. I believe that it's the former Wheels skate park.
Yep.
So for the most part, they're able to do upwards of, right now they're looking at possibly gearing up to be able to do 1,000 vaccines there. Durham Public Health is assisting them in scheduling. You definitely can come here at the Health Department, 414 East Main Street, and we certainly welcome everyone. Two sites that I'll give you to where you could locate it. Again, decopublichealth.org/COVID-19 vaccines with an S. Or you can go to the North Carolina Department of Health and Human Services website at ncdhhs.gov. All of our splash pages have everything about COVID vaccines. And the good thing about the Durham County site is that we got a vaccine locator, so you could actually click on it and it gives you all the information you need in order to be able to, know what you need to do to prepare. And then, of course, in signing up, we have worked hard, very hard, Karen and others, to make signing up so easy. So there's a link, and all you got to do is click it. You don't have to log into anything. You just put your information, small bits of information, and then we call you and we do the rest. I'd be remiss if I didn't say that the Pfizer vaccine is available to those who are 16 years of age and older. You do need some consent from your parents, but effective on April the 7th, the vaccine is available to anyone who is 16 years of age and older who would like to partake in the vaccine. So again, we're here for this community. We will not stop until this pandemic is over.
All right. Well, that was great. Thank you so much for this information. I hope that somebody finds it helpful. I hope somebody passes it along to someone else who might find it helpful so that we can get back to normal, or whatever our normal is going to look like moving forward. I'm just anxious for us to get there.
I'm with you. I'm with you. There's so much to do and so much to see in Durham. Durham is such a vibrant community, and we're going to get there. Spring is upon us, and you're starting to see a lot more activity going on. But we just want everybody in the listening audience to know that you can enjoy Durham and other communities safely, but the key word is safe. You don't want to be reckless. You don't want to make any rash decisions as far as this pandemic is concerned, because it's still here. There's still on average, on a weekly average, Karen, about 40 to 50 people still getting positive COVID tests and everything. So we want to make sure that we be careful that you're not in the statistic, but the surefire way to do it is to get your vaccine.
All right. Sounds good. Thank you so much for chatting with us and sharing this information with our listening audience. And I hope people find it to be helpful.
Dee, thank you for having me.
Thank you. Bye-bye.